Welcome to today's episode of our podcast, dedicated to mental health professionals, counselors, and therapists. I'm thrilled to share with you a companion episode to the course titled 3 CE Hours Mindfulness-Based Relapse Prevention Techniques Offered by Therapy Trainings. If you're looking to deepen your understanding of mindfulness and its application in relapse prevention, you're in the right place. Throughout this episode, we'll explore the core concepts of mindfulness-based relapse prevention, discuss practical techniques you can implement in your practice, address some common misconceptions, and provide key takeaways that can enhance your work with clients dealing with substance use and other addictive behaviors. So let's dive in. First, let's talk about what mindfulness is and why it's so critical in the context of relapse prevention. Mindfulness is essentially the practice of being present and fully engaged in the moment, without judgment. It's about observing your thoughts, emotions, and physical sensations as they arise, rather than getting swept away by them. This non-judgmental awareness creates space for us to respond to our experiences rather than react impulsively, which is particularly crucial for individuals in recovery. One of the central ideas in the course is that relapse doesn't just happen out of the blue. It's often preceded by a series of triggers, cravings, and emotional challenges. By cultivating mindfulness, clients can learn to identify these triggers and manage their responses in a healthier way. For instance, let's say a client walks into a bar and the smell of alcohol triggers a craving. A mindful approach would encourage them to take a moment to pause, breathe, and acknowledge that craving without automatically acting on it. Instead of thinking, I have to have a drink, they might think, this is just a craving, it will pass. This shift in perspective can be incredibly empowering. Now let's move on to the 3 key mindfulness-based techniques that the course highlights. The first technique is mindful breathing. It's a simple yet powerful tool. When clients focus on their breath, they anchor themselves in the present moment. This practice can be incredibly grounding, especially during times of stress or temptation. Encourage your clients to take a few minutes each day to practice mindful breathing. They can do this by inhaling deeply through their nose, holding for a moment, and exhaling slowly through their mouth. Over time, this practice can help reduce anxiety and increase emotional regulation. The second technique we explore is body scan meditation. This practice involves mentally scanning the body from head to toe, paying attention to any sensations, tension, or discomfort without judgment. It helps clients reconnect with their physical selves and can be particularly beneficial for those who've dissociated from their bodies due to substance use. By cultivating awareness of bodily sensations, clients can better understand how emotions manifest physically, which can be crucial for preventing relapse. Now, I understand that many of you might be thinking, but what if my clients find it hard to focus or feel overwhelmed during these practices? That brings us to our third technique, mindful observation. This is about encouraging clients to observe their surroundings or certain objects in their environment. By focusing their attention on something external rather than internal distractions, they can develop a sense of calm and presence without the pressure of managing their thoughts right away. Imagine this. You're sitting with a client who struggles with anxious thoughts. Instead of diving into those thoughts, you might guide them to observe a flower in the room, noticing its colors, shape, and texture. This shift in focus can help them create distance from their anxious thoughts and cultivate a sense of peace. Now that we've covered these techniques, let's address some common misconceptions about mindfulness and relapse prevention. One misconception is that mindfulness is a quick fix or a one-size-fits-all solution. In reality, mindfulness is a practice that takes time, patience, and commitment to develop. It's essential to help clients understand that it's not about eliminating difficult emotions or cravings, but rather learning to coexist with them without acting on them. Another common belief is that mindfulness is only for those who are calm or who already have a certain level of emotional control. In truth, mindfulness can be particularly beneficial for those experiencing distress. It's about meeting clients where they are and offering them tools to navigate their feelings no matter how turbulent they may be. As mental health professionals, we can also fall into the trap of thinking that we need to be experts in mindfulness before we can teach it to our clients. While having a solid understanding is important, the reality is that you can start incorporating mindfulness techniques into your practice right away. Even sharing your own experiences with mindfulness can create a relatable environment for your clients. Now, here's a thought-provoking insight. Imagine the ripple effect of incorporating mindfulness-based relapse prevention techniques into your practice. Not only are you equipping your clients with valuable tools for their recovery journey, but you're also modeling a mindful approach yourself. By embodying these practices, you create a space where clients feel safe to explore their emotions and behaviors without fear of judgment. To wrap up this episode, let's reflect on the key takeaways from the course and our discussion today. First, remember that mindfulness is about being present and acknowledging thoughts and feelings without judgment. Second, the 3 techniques we explored, mindful breathing, body scan meditation, and mindful observation, are valuable tools that can empower your clients in their recovery journey. Finally, be aware of common misconceptions and embrace the journey of learning and growth, now both for yourself and your clients. As you continue to explore mindfulness-based techniques, I encourage you to consider how you might integrate them into your practice. What strategies resonate with you? How can you create a mindful space for your clients? And most importantly, how can these practices enhance your therapeutic relationships and support your clients in their recovery? If you're interested in diving deeper into this topic, I highly recommend checking out the course 3 CE Hours Mindfulness-Based Relapse Prevention Techniques offered by Therapy Trainings. You can find more information at therapytrainings.com. They offer a wealth of resources and courses that can enrich your professional development and enhance your therapeutic skills. Thank you for joining me today in this exploration of mindfulness-based relapse prevention techniques. I hope you found this episode informative and inspiring. Until next time, take care of yourselves and your clients. And remember, mindfulness is a journey, not a destination. Let's commit to walking that path together.